Hi, Sheena. Good afternoon.
Hi, how are you?
Good, and you?
Good, thank you. I'm gonna put my video on so I don't look like Dan.
Hi there.
Hi, good afternoon.
Good to see you. Hi, Dr. Lewis.
Mary.
Sheena, if you wouldn't mind making me co-host, I just had a intro slide of the event. Thank you.
No problem. You should be good to go now.
Perfect, thanks.
Mhm.
Okay, so we'll get started. Thank you everyone so much for being here. We're really excited to have this event today and really pleased to see our wonderful panelists here, as well as plenty of students who are interested in learning from these panelists. So I recognize a few from Allen University, Howard University. Anybody else who's a student attendee want to call out which institution you're calling in from? It's also okay. Don't feel pressure to be on the stage or anything. So yes, we're really excited to introduce our panelists. So yes, Sheena's right. Feel free to just add it to the chat. Yeah, perfect. Great. We'd love to see where everybody is calling in from. So yes, so we are, thanks for everybody for taking the time to be here. Our event, as you know, is called Career Opportunities in Biomaterials for HBCU students. And it's hosted by our organization. We're the national student section of the Society for Biomaterials. So I'm Jerry Coons. I'm president of the national student section, and I'm an MD PhD student at Baylor College of Medicine and Rice University in Houston, Texas. But much more importantly are the introductions of our very impressive panelists, two of whom are themselves alums of HBCUs, and three who have gained industry or government experience during their training. And all six are making really important contributions to the advancement of medicine and to education by researching materials for use in medicine or biomaterials. So first, I'd like to introduce Dr. Greg Duncan. Dr. Duncan is an assistant professor of bioengineering at the University of Maryland. He studied chemical engineering at Florida State University for his Bachelor of Science and performed his PhD studies in chemical and biomolecular engineering at Johns Hopkins University. His many awards include the Rising Star Award and Young Investigator Award from the Biomedical Engineering Society, the Career Award from the National Science Foundation, and the Faculty Teaching Award from his university department. Dr. Cheryl Gamillion is an assistant professor in the Regenerative Bioscience Center at the University of Georgia. She studied biosystems engineering with an emphasis in applied biotechnology at Clemson University for her Bachelor of Science, and her Master of Science and PhD in bioengineering, also from Clemson University. Her dedication to mentorship was recently recognized with the Research Mentoring Award from the UGA Center for Undergraduate Research Opportunities, and also with the National Science Foundation grant on developing diverse cultures within graduate engineering research laboratories. Dr. Antenta Hinton is an assistant professor of molecular physiology and biophysics at Vanderbilt University School of Medicine. He studied biology with a minor in chemistry at Winston-Salem State University for his Bachelor of Science and received his PhD cum laude from Baylor College of Medicine, Department of Integrative Molecular and Biomedical Sciences. His HBCU alma mater honored him with the Alumni Achievement Award for the Department of Natural and Physical Sciences, and he also received the University of Iowa Diversity Catalyst Award for his leadership in diversity initiatives. Dr. Catherine Fay Whittington is an assistant professor of biomedical engineering at Worcester Polytechnic Institute. She studied biomedical engineering at Louisiana Tech for her Bachelor of Science, followed by her PhD in biomedical engineering from Purdue University. She also performed a postdoctoral fellowship in the pharmaceutical industry with Eli Lilly and Company. She was recently awarded the Career Development Award from the Pancreatic Cancer Action Network, as well as a Women's Impact Network Grant Award to fund a summer research program for undergraduate students. Dr. Jamal Lewis is an associate professor of biomedical engineering at the University of California, Davis. He studied chemical engineering at Florida Agricultural and Mechanical University for his bachelor's degree, attended North Carolina State University for his master's in biomedical engineering, and completed his PhD in biomedical engineering at the University of Florida. He also worked at OneVax LLC, a biotechnology company working on developing a vaccine for diabetes. Our Society for Biomaterials has granted him the STAR Award, and the Biomedical Engineering Society honored him with the Innovation and Career Development Award. Dr. Pumptowit McCarthy, who is, she mentioned that she will be joining us a little bit later. She's an assistant professor of chemistry at Morgan State University. She studied biochemistry for her Bachelor of Science at Rowan University, followed by a PhD in biochemistry from the University of Delaware. She also performed an internship with the FDA Center for Biologics Evaluation and Research. She has received multiple grant awards from the Office of Technology Transfer of her institution, as well as the startup allocation funding for the National Science Foundation for an extreme science and engineering discovery environment. So just wanted to let you know who we have the pleasure of learning from today. And I'm just going to kick things off by asking one foundational question, but then the audience members are welcome to chime in either through the chat or when we open up the floor for questions. If you'd like to ask over audio, please feel free to ask whatever you'd like. So the first question is, how would you define biomaterials and biomaterials research? And what first made you interested in pursuing a career about biomaterials? Anybody is welcome to chime in, any of the panelists.
I'll go first with what I guess I'll go with the second question first. So I got actually interested in like biomaterials and tissue engineering towards the end of my undergraduate. And so this I might be dating myself, but like at that time, that was still kind of much more emerging in terms of like our school didn't have anybody doing biomaterials or tissue engineering work in that way until except for one biology professor, and it was very much like, oh, what is this thing that he's doing? And so I had gone to a couple of conferences, including the Biomedical Engineering Society annual meeting that year. And so those are the types of events that I went to, like the seminars and things like that. And I just thought it was really cool. At the time, it was really a lot of talk about replacing organs and things. And I really, had personal experience with a friend who needed an organ transplant growing up. And so this prospect was really cool. But, at the time, now I've been kind of thinking about it now, I was actually working in materials research, but it wasn't really called materials research in that way. That's not how the lab really defined it. It was more of a protein engineering lab, but I was working on different types of material films that were used for drug delivery type release. So, I think sometimes, even when we think about something like drug delivery, remembering that materials are related to that. I use materials right now for more modeling diseases and everything. So, it's not just about, in my case, I don't do it with biomaterials for implanting it into a body or anything like that. I'm using properties to be able to mimic some of the things that are happening in the body so that we can learn more stuff outside of the body rather than working on the materials for, actual use in the body right now. So.
Awesome, thank you. And I think what you're hitting on is there's a lot of different directions that you can go in within this general field. There can be diagnosis, there can be modeling what diseases are so we can learn more about them. There can be therapies. So there's a lot of different cool things. And I'm sure one of our other panelists is hitting on another area in that as well.
So I'll go. So I'll do the second question. So I study mitochondrial interactions and how they cause pathophysiology. And so one particular area that is really focused on biomaterials is screening FDA drugs that are already approved and see how they alter mitochondrial dynamics and energetics in the cell, but also at a structural level. We use FibSim, which is commonly used in, or SEM, scanning electron microscopy for everyone that doesn't know. And FibSim is focused ion beam scanning electron microscopy, which is more of a high-powered SEM that uses fine details to be able to see areas that wouldn't be captured with SEM in as greater detail. So basically, what we're doing in the laboratory is using FibSim and also serial block facing SEM to also understand how the structure of the mitochondria are networked together in certain tissues. But then we're seeing how these FDA approved drugs change mitochondrial structure over time, and whether or not if any of these FDA approved drugs can actually be delivered at the nanoscale and actually repair the altered structure that has occurred due to pathophysiology. So one quick example is when you age, your mitochondria, they actually lose their networking ability. They don't have nanotunnels anymore. Some aged muscle sometimes has nanotunnels. Those are kind of very weird mitochondrial disease cases. But the point of this is that we want to be able to rejoin networks. So we're trying to stimulate energetics to occur to where there's fusion and fission cycles occurring again, where mitochondria can join. And then the other issue is that with aging, your cristae fall apart. If you're not familiar with cristae, those are those little kind of cute little folds that are inside mitochondria in the book that look like kind of a road, a windy road that's going around a mountain. And so basically they fall apart when you age. And so what we're trying to do is kind of keep the winding road together. So it's really easy to get from point A to point B. And so we really enjoy doing that in the laboratory. And if you all are ever interested in an internship, just let me know too. And I enjoy biophysics. I'm more on the biophysics side of biomaterials. And I picked that because I felt like I could use computational biology as well as like my background and like an interdisciplinary degree to be able to come up with interesting questions to try to bridge the two. So that's why I study that. And I think that it provides a focus on some of my family roots of what they've been affected by and how I can integrate that into my science practice. So.
Thank you so much. Yeah, and I think what both you and Dr. Whittington mentioned is a lot of us end up in this field because we or our family members have ended up being affected by healthcare in some way, having some kind of condition that they've needed a treatment for, and knowing that we can possibly be part of the process that brings more of these treatments available to other people's family members and friends.
Well, I can try this question, like, what is a biomaterial? This is actually, I have a whole class on like biomaterials that, like, just starting here at the starting point, it's even hard to define. But I sort of have broken it up into two classes of materials. So they're like native or natural biomaterials. So things like collagen, things you find in the human body that help to kind of give our tissue structure. And then there are synthetic biomaterials. So things that are man-made, but are made in a way that they're compatible for, you know, an implant, for drug delivery, for some of the many applications that folks are interested in. So there's just some general considerations in terms of making synthetic biomaterials. So are they, you know, not going to be toxic to your body when they're injected or implanted? Are they going to degrade in a fashion that's, you know, appropriate for the application, and things that you just want to keep in mind when designing them? And a lot of the time people are interested in using natural biomaterials because they kind of already fit into that class of things that are compatible with the body and can be degraded through natural mechanisms, and often give you a lot of the bioactivity that you're looking for tissue engineering or other application that you might have in mind for biomaterials are often useful. That's kind of like a short answer for that one. If folks are just to define things.
Yeah, I'll jump in really quickly and add on to that. I think Greg is on point, and he is a professor in biomaterials and teaches biomaterials, so he's definitely in point with his definitions. But I'll just add on and say that, you know, biomaterials is technically anything that is used to support the function of the human body, period. So, you know, the earliest biomaterial, I think, was actually just a wooden peg, right? Because it's used to support, in some way, shape, or form, the function of human life. And we can also think of things such as, you know, in terms of early biomaterials, you know, fake teeth, right? So, you know, and it doesn't necessarily have to be something that is actually inserted into the body, as Catherine indicated, right? It could also be things that, you know, are used outside of the body to study bodily functions. So it's really sort of a broad category of materials that are considered to be biomaterials. And then get into the second question from my personal experience, why I chose to study biomaterials. I'll also echo what Catherine said. You know, when I was a teenager, essentially, I happened across a 60-minute presentation on tissue engineering, right? So Anthony Atala, who was one of the sort of premier luminaries in the field of tissue engineering, he was working on sort of tissue engineering, just, you know, organs to be to be put back into humans. He was tissue engineering, I think, livers at the time, and there was another investigator, I forget his name, he was working on like the ear. So he actually tissue engineered an ear into the back of a rat. And it was featured on 60 Minutes, and I thought that was just cool. You know, I thought that was sort of a really cool application. I thought the future for that looked really bright, and I wanted to be involved, and so that's why I got involved in biomedical engineering and tissue engineering and now cell engineering.
I think I'm the last one. And a lot of what I guess I'll contribute is very similar to what Jamal and Catherine also mentioned. So I think Catherine and I, we go way back to undergrad days as well, or late grad school days. And so our paths have crossed because, you know, it's very similar. I think I learned about this field of tissue engineering from a professor at Clemson, mainly because I completed some co-op experience as an undergrad, and I learned that that was not what I wanted to do later. And so I was looking and searching and scrounging for something that I did like and what, you know, another alternative career path. And so she told me about this field of tissue engineering, and that was my first introduction into biomaterials and how they could be used for, you know, applications in the body, and allowing, in my case, you know, personal connection to breast cancer research, because my mom was a breast cancer survivor. She talked about using materials for developing reconstruction options for breast cancer patients. And so that really kind of captured all of the things I was interested in at the time. I figured out, you know, how to use those materials in my research for that, but then also, like Catherine, kind of, you know, how can we use those in the laboratory as well to mimic disease systems and model those to learn more about these disease processes. And so a lot of what we do in my research area still is very similar, and we use materials in those ways also.
Fantastic. Yeah, thank you all so much for defining that. I think maybe a take-home message of that is there's a lot of things that we, you know, before we know that they're called biomaterials, we have some kind of interaction with them. They're present in the media, they're present in the healthcare delivery that our friends and family members access. So exactly, yeah, that's really helpful. And Dr. McCarthy, yes, I just wanted to fill you in on the question was, the first part of the question is, how would you define? And then the second part is, what led you to be interested in a career in biomaterials?
Hello, thank you. Sorry for joining so late. Yeah, so I think maybe I have a little different background from some of the other panelists in terms of my background is not specifically engineering. I'm a biochemist, and I look at part of my research is involved in using sugars or polysaccharides as components of vaccines, glycoconjugate vaccines. And my newer area of research is thinking of biomaterials more as biologically inspired materials in terms of using these sugars or polysaccharides as new tools that can be used to capture metal for water remediation. So some of the things that inspired me, I'm sorry, my son's, sorry about that. Some of the things that have inspired me to, go on this new path of biomaterials is I just realized, just the different ways that sugars can be used. I mean, typically the sugars that I study, as I said, are involved in vaccine development, but really thinking about sugars as these specifically from a pathogen called Neisseria meningitidis, no one has really looked at them as, as a source of biomaterials. So this was, a new path that I decided to embark on because I think polysaccharides are very much known. Things such as chitosan and other functionalized chitosan can be used for different applications. So I thought the polysaccharides that I study could also be used in that way. So taking a different turn than everyone else was really interesting to me.
Yeah, so that hits on another really cool aspect of biomaterials is a lot of times we're trying to model nature. So it relies on the biologists and people who have discovered what it is actually like in nature in order for us to try to model after that. And then you see, like with Dr. Whittington's work, trying to model also some of those disease processes and everything too. So that ties it together really nicely. Thank you guys, those responses were all really helpful. Do any of the students have any questions either in the chat or want to unmute and ask? It's okay if not, we have some other discussion topics, so you can just keep listening, but I just wanted to make sure if you had any specific things in mind, you got to ask those. Okay, we'll see if you guys come up with some other as we go. Would each of you mind telling us about the pathway your career has taken? So each of you started from college, where most of our audience members are in now, and then how did you get to where you are now, and what kinds of things helped you decide, like Dr. Gamillion mentioned, you know, having one experience in one type of field, like in industry, working for a company, and saying, hey, that's not really for me. What were the experience that you had that helped you realize what type of career you want to have in general, and then, you know, in a field related to biomaterials?
I guess I'll go. Seems like everybody's waiting for the first person to go, then they'll go. So it wasn't really one experience, it was multiple experiences. So after I finished my PhD at Baylor and I went to undergrad at Winston-Salem, both of my mentors in both of those places encouraged me to do a postdoc. I wasn't so much keen on doing a postdoc, but I decided to go to the University of Iowa because I met someone at a conference, and he was one of the most successful Black scientists. He has like an H index of 90. He does really, really well. He's very kind of quiet and keeps to himself. And so you wouldn't kind of know, you know, a lot about him. And so Dr. Abel, I met him at a conference. We were talking and chatting. He asked me to tell me his goals. And then I told him my goals, and then we kind of, you know, went back and forth about different things. What was really interesting was how he talked to me. I've never had someone treat me as if I was an equal, but at the same time, mentoring me at the same time. He said, you know, you have your PhD, you're a colleague. He's like, you know, I just want to sharpen your tool belt. And when he said that, he was saying, you know, I'm offering you a postdoc if you want to come and interview. And he also paid for me to go to another place to interview, because he says, after you experience where I'm at, you won't, you know, want to go somewhere else. So he was very confident. He was right. I went on a lot of other interviews. I went on 8 other interviews, and then it was just something about that lab. And that experience over those, you know, 4.5 to 5 years was life-changing for me, because it also led to me getting my faculty position at Vanderbilt. And he accommodated the techniques that I wanted to learn, like FibSim and serial block facing. So he contacted Mayo Clinic and set up a second postdoc for me, where he paid for me to be there at Mayo every 2 weeks. And then I would go back to Iowa, you know, and vice versa. And we did that for 2.5 years. And so it was really nice, because it gave me the specialty skills to be recruited for a faculty position. And so that to me was my defining moment throughout my career, that really changed my trajectory. As far as what I researched, it was my family and the deaths that I saw that happened too early. And so for me, I feel like I can make a lot of intervention changes with mitochondrial, I guess you could say, changing the structure of mitochondria. So.
Thank you so much for sharing that. And I think a few different panelists have mentioned the opportunities that arise from going to a conference. So I'm just going to drop a link in the chat, but we actually have a member of our organization who is an MD PhD, Dr. Lorenzen, who hosts a travel fellowship to attend the conference for Society for Biomaterials. And that is due December 3. So you all have plenty of time. So if you're really interested in about what you hear about today and would like the opportunity to go, the conference is currently planned to be in person in April in Baltimore, Maryland, but it might even hopefully not, but it sometimes turns virtual and then it might even be easier to attend. But please check out that link if you are interested in maybe going to one of these conferences. And like Dr. Hinton said, getting this opportunity to talk one-on-one with people is really an amazing way for them to get to know you individually. Anybody else like to?
I'll go.
Go ahead.
Yeah, so I mentioned that I had done research as an undergrad when I was talking about like the release from films and stuff. And while I was there, I thought, you know, I liked the research, but I wasn't really into what I was doing necessarily. And I had that interest in tissue engineering. So like I had never worked with cells before or anything like that, but like I was going to grad school interviews and saying like, I want to do tissue engineering, you know, and I had my reasons why. And then just kind of, I went to grad school because I did think that I wanted to be a professor, and I don't really remember what it was that made me think that I wanted to be a professor, but you know, I had been involved in like tutoring stuff and I enjoyed the academic environment. But I mean, truth be told, I don't think I had like the best reason at the time for wanting to be a professor, but I just like, it sounds like a good idea. So, but as I went through PhD, you know, I still thought that that was the route that I wanted to go. But then when I was looking for the postdoctoral position to get more training after my PhD in preparation for a faculty position, I received this opportunity. Like I came across this opportunity to apply to this program at Eli Lilly and Company. And I was like, no, thank you. Like, I'm not interested. I'm looking for academic postdocs. And then it came about again, like somebody else sent it to me and I'm like, fine, whatever. Like, I'll go for it, because I also did realize that I didn't have industry experience and I didn't have any sort of dim view of industry. I had no problem with it, but I just didn't think that was the environment. But I ended up at Lilly and it was a really great experience. I was able to get to work in the cancer space that I wanted to get more experience in. I determined that I still missed working with students. I liked some of the autonomy that I would be able to have as a faculty member and running my own research program. And then just, granted, I was just at one place at Lilly, but just overall in the cancer space, I was realizing that from a pharmaceutical company standpoint, the types of things that I was interested in, the types of research questions I was interested in was not what the companies were interested in. I was interested in metastasis, so the advanced part of cancer that really is problematic and what ends up killing a lot of people, but that just wasn't what the companies were interested in targeting. They were focusing in on the primary tumor, which there's a variety of reasons why, and I get it. So, I ultimately decided that, I wanted to at least take some time to work on the types of problems that I wanted to work on and work with students in the process, which was something I really missed. So that's kind of what brought me back, but not because I had a bad experience in industry. I was in research and development, and it was still had a very academic feel to it in a lot of ways, but it was still ultimately, the business side still came in a lot more, and that's where a lot of the decision making was coming in. And I wanted to make more of my own decisions for myself in my research program.
I can go next. So I did my undergrad, I did research at Rowan University, and I had, undergraduate research experience, which really led me on the path, thinking about, having some sort of career in research. So I went to graduate school at University of Delaware, and I was in a program where it was called the Chemistry Biology Interface. So it really allowed me to, think very interdisciplinary. And I knew after I finished there, I wanted to go off and do a postdoc. So I did a government postdoc. I was a postdoc at the FDA in the Center for Biological Research and Evaluation. And that particular center at the time was at the NIH campus. So for some reason, I always had this dream of working at the NIH, and somehow that happened. So while I was there, I really took a lot of time to try different things on. At NIH, they have what's known as the Office of Intramural Training and Education, where you can, it's really for postdocs and really to try to understand what path you want to go on in your career. So I did all of those things like the Myers-Briggs inventory. I even, did informational interviews with lots of different career paths. And at the end of it, I decided that academia was where I wanted to be. I always have a passion for passion for mentoring, and also the research aspect of working on a problem that I control for the most part. Research controls us mainly, but working on a problem that interests me. And so that's how I got to where I am at Morgan State.
I just wanted to jump back in really quickly because something you said resonated with me about like when you did like the informational interviews. And that was something that with like, we didn't necessarily do it in that way whenever I was at Lilly, but we were very encouraged to reach out to people who were performing different functions at the company so that we could learn more about what people did and their career paths. And in some cases, we had people come in and talk to our postdoc group and they would share, but that was just really helpful to me. And I feel like it's also still helpful for me as a faculty member because I can give students a much better perspective on what are the types of things that you can do with your degree if you don't want to be a faculty member, which is perfectly fine. And, you know, seeing that there were people at Lilly who, you know, had the science background, whether they had bachelor's, master's, associates, PhD, whatever, but how they were using it in different ways. It didn't always mean working in the research labs. People were working on the legal team. They were working in intelligence. They were working in patient safety. So just all these different things that were really helpful, but it really came down to asking those questions of people and finding out, you know, like, how did you get there? Just like you're asking us those questions here, but, you know, don't be shy about asking people who are doing other things, what they do, especially if it's something that you think is cool and that you might like to do. So that's just my plug for like, ask lots of questions to people because you'll learn so much.
If you don't mind, I wanted to jump in really quick because this is funny enough, my internship I did during undergraduate was at Eli Lilly. And that was really the chance where I got to learn a lot about the different career options there were. I was working in like a biomedical device area. It was where my internship was on insulin pens for diabetes and trying to make better electronic insulin pens. But at the time, they encouraged us to go out and talk to other people in other divisions. And I ended up going over to the drug discovery area and talking with research scientists there. And I was just like blown away when they walked me through the facility and I saw all the really cool just toys they had in there. But the instrumentation was really impressive. I love that they were doing high throughput screening, all that sort of stuff. And I was convinced that was what I needed to do. It's not what I do now, but I was just convinced that research was really what was the direction for me. And some experience I got as an undergraduate as a researcher and working with a professor there, which at the time when I was an undergrad, I had no idea that there were research labs, like period. It wasn't until one of the professors pulled me aside and told me, you know, I have a research lab and I think you're, you know, doing well in my class. So, you know, would you want to work with me? At first I said no, because I was just like, what do you mean? Like, I don't know what research is, what you're doing. Then he told me he would pay me like hourly. And I was like, oh, all right, well, I don't have a job, so I should probably do something to get some ends meet. So I ended up doing that, and then I really loved it. So I'm always appreciative of the opportunity that I got at the time. And fortunately, he had some funding you could get to convince me. But totally changed my career path. I was interested in industry starting out, an undergraduate, and even in my PhD, I was still thinking about industry, but I never really lost the just the desire to do my own research and kind of learn new things. So that's kind of how I got started.
Yeah, I don't want to echo too many things of what the other panelists have said, but you know, it's pretty similar for me. You know, I had a lot of interest in doing biomedical engineering, and particularly in tissue engineering. What I do now is more considered to be immune engineering. My lab is called the Immunomodular Biomaterials Lab. And so, you know, how I got here is essentially, you know, I serendipity a little bit because, you know, just like Greg and others have mentioned, you know, it was a professor saying, hey, you know, I think you're talented in this area, you know, come work in my lab. And very similar, you know, little interest in working in the lab, but as soon as they say, hey, I'll pay you, you know, all of a sudden perked up. And then, you know, it was like each and every year a professor saying, hey, you know, do this undergraduate research experience and it will pay you $5,000, $10,000. Like, okay. a lot of money for an undergraduate. And so that got me interested in research, really interested in research, and propelled me to take a shot at grad school. And then once I got to grad school, I was still interested in tissue engineering. I'm interested in the industry, but when I got out of grad school, when I was finishing grad school, my professor, sort of dangled this card in front of me saying, hey, instead of going to industry or going to do a postdoc elsewhere, why don't you help me start up this company? And so, I got involved in that and helped to launch the company and helped to, sort of get, funding in for the company. And because I was, it was sort of just me sort of driving that project, I got interested in sort of having, sort of doing my own thing and having the creative freedom to do my own thing and lead my own lab. And so that's what propelled me further to actually apply for academic positions because, as the company grew, we got more people involved and sort of more regulation of what I could and can't do. But I really enjoyed sort of just like having the freedom to just call the shots and pursue directions that I wanted to pursue. And academia gives you that option. So that's how I ended up in academia because I can really literally wake up, dream something up the night before, wake up the next day and go say, hey, let's try this in the lab. So yeah, that's how I ended up here.
I think a lot of my story is similar to what you've already heard. So kind of just being open to the opportunities that somehow presented themselves. So I didn't know what a PhD was. I didn't really know what grad school was, even starting undergrad. And like I always, so my parents didn't, they were not college graduates. I had an older sister and brother that went to college, but, the whole idea was go to college so you can get a job. And so I did that. I always had an interest in medicine. So I think my forward thinking was like, oh, okay, I'll go to med school. That was what I knew of a doctor. But I also decided and realized that I didn't necessarily have the best patient bedside manner, maybe. So finding biomedical engineering was a great thing for me because we could still make contributions to medicine, but, less on the I need to have people skills side. So finding research was really, I'm doing a co-op opportunity that working in a quality assurance lab was great, but it wasn't quite creative sparking or it didn't speak to me in that way. So I need to change my major and then freaking out because that was junior year. Like, this is not going to work. My parents did not want to hear that. So talking with other people led to me finding, hey, if you thought about research in this bioengineering department, I'm like, we have that. What is that? So everything kind of just happened because I was learning more about opportunities that were out there and meeting people that helped introduce me to those opportunities. So even going to grad school at first, it was like, all right, I'll do a master's degree because I want to learn more about this field. I'm not changing my major now as an undergrad. I'm going to finish this, but I want to learn more about this field of bioengineering. And then somewhere in there, having a chance to do outreach activities, start, getting in front of people and teaching other, whether it was K-12 students or undergrads about what we were doing. And then, realizing that there's opportunity in this space for, people that look like me to be faculty and to like impact others in a different way. And so that's what kind of led or really sparked me towards doing a PhD was, I never had any Black professors, period. So when I got a chance to do a PhD, I decided to stay there because I want to go and have a chance to, help impact students in other ways for myself. And so even getting to a postdoc or considering postdoc, that kind of came through SFB. So these connections that we have, like my faculty mentor at the time, she took us to SFB as students. I got to meet other people, professors that were there. The job board there said, hey, we're applying, we have an opening for a postdoc. And so that, I applied for that and that's how I ended up in Connecticut. And all of those things kind of one step just kind of led to another. So I think taking advantage of the opportunities and being open to those opportunities as they come is important for that.
Absolutely. All those answers are so helpful because hopefully the audience members can say, hey, okay, I was where they were at one time and now look where they are now. And hopefully somebody else can end up as like one of these amazing positions that each of you are in too. We have a question from one of our audience members, Javante Robinson from Allen University.
Oh yes, quick question. With you all being prominent Black scientists, how has that affected your advancement?
I'll chime in. So I guess you can take that or answer that in multiple ways, maybe. So in many cases, I think there are not always people that look like you in these spaces. So I think you are often challenged with, just finding networks of people that you relate to, but then also being open to, having mentors that don't look like you, having others and finding ways to interact with people and learning from any and everyone, because those are the people that may have your best interest at heart. And just because, they're not Black doesn't mean that they're not going to be, great supporters and, champions for you. So I think there's one thing, but, having to develop a thick skin sometimes because you are in silos, maybe, in your departments or in, your societies, depending on what your actual field is. Like, I think Catherine and I know each other because we are one of few that have been in, spaces together for a period of time. So I think there's pros and cons to all of the things that we interact or encounter as Black scientists in this space.
That's a loaded question. Let's see. I mean, I'll tell you what I try to do to make the space better for all of us, instead of focusing on a lot of the other things so that everyone else can talk about things. So just to be honest and frank, it's very hard to be a Black scientist at any institution. It doesn't matter if you're at an Ivy League or even if you're at an HBCU or minority serving institution, because there's different challenges that present themselves, because sometimes you're not even a majority of faculty at a minority serving institution. But that's a whole nother set of circumstances. For my institution, I'm the only one that's a male that's a faculty member in the basic sciences. There are two in the entire basic sciences of the medical school. So there's Dr. Breanne Brown and myself at Vanderbilt. In other areas, there are some. So in total, we do have some, but in each where, I'm housed in the medical school, there's only two. And in other departments like chemistry, there are, I think, 2 or 3. So there are some in the arts and sciences, but it's very few. And so that impacts your performance to a certain degree. So I have to have a team around myself to make sure that I'm doing well, holding myself accountable, and what's realistic. Am I referring to the anxiety of being Black at a predominantly white institution, or am I actually doing just fine? And I don't have to like overcompensate. So there's some things that you have to really have to secure yourself to make sure that you have good balance, because it can get out of control trying to please everybody's expectations when you're not focused on really what you need to do for your target goals. And then I would say that it's always important to get funding, and funding can be a challenge at any level. And so I think the most important thing is to start writing now and figure out what that means to write well for yourself, and then figure out your patterns, your idiosyncrasies around writing, so that you can have that down if you decide to be a professor or in any other career, because writing is important regardless of where you go in STEM, and that should help to some degree. And then the last thing I would say is that what I try to do to make the space better is to reach out and to reach up at the same time, meaning that you should allow other people that are in your network that are maybe at a stage below you to be introduced to people that are above you, so that they can have the same type of mentoring opportunities that you've had. And then I also try to do a lot of outreach. I think it's our job, but also everyone's job, to be able to create a safe space. But sometimes maybe they need a helping hand in how to do that, right? So that's why I like to do a lot of the diversity, equity, inclusion, but try to balance it with also doing research as well. So, yeah.
Thank you both for
I can
that.
add really quickly. I mean, the main thing is that you're just recognized immediately because you're, the only person of color potentially in your department. So you're immediately recognized, and that I think that it comes with, there's good and bad things to that. The good thing is that when, they want to kind of make sure they're promoting you. I mean, if you're in the right space with the right people, you'll get a lot of support, and they want to make sure that one faculty member of color is doing well. So my experience has been people kind of really rally around that, and you can find people that are allies and that'll support what you're doing. On the flip side of that, you're also recognized as have done very well and done exceptionally well in your area, and being the only one of color. They want you to be a kind of a sounding board for everybody else that's kind of at the undergraduate stage, graduate student stage. And that can be, I think was mentioned, kind of overwhelming when everybody's coming to you asking for help with, different initiatives with all of their own merits, but you just kind of have to be comfortable saying, I have enough time for X, and I'm going to put I like to just think of it as, if I can't give 100% effort to something, then it's really not, they're not going to get out of it what they hope to get out of it from me. So just have to be comfortable with kind of setting some boundaries on how much you get involved with, and make sure that it kind of aligns with your kind of longer term goals and vision for your career.
I was just gonna say that when I think about it as far as like affected my advancement, I don't know as much about, how maybe it's affected my advancement aside from, I think there are situations where there have been people who have, reached out to me perhaps because, they want to be that source of support, or they want to be, like help you advance because they know that things can be difficult, and they know that, it can be isolating. And so I definitely do think that there are some people in my life that, not necessarily because I'm Black, but just in general thinking about, like, how can I help her? How can I support her in different ways? And there's been a couple of times that, I think there's one professor that I had as an undergrad, and I still like see him at conferences and stuff. And I remember he had asked me about working in his research lab as an undergrad, but I had to turn him down because I already had a position. But we've just kind of stayed in touch over the years. And then I realized at one of the conferences that we see each other at, that he was mentoring me. Like, it wasn't that we had this conversation about it, but just I realized like the types of questions he was asking. And then, he asked me, had I met this person from the National Institutes of Health yet? And I said, well, I've talked to her on the phone, but I haven't met her in person. He's like, oh, let me call her and see if she's here right now. She wasn't, but just like, things like that where, again, there's lots of people that don't get that type of support. And I recognize that. And then, something that Cheryl said earlier about like not having a Black professor, or, like not seeing it. And so I think there are certain things about some of the decisions that I make now in regards to students that are, based in that, like knowing that they are the only one or one of few, or that they might not have had exposure to fill in the blank, or that they want to go to grad school, but they don't think they can, but like nobody else has said like, yeah, let's get you into grad school. And then you think about, well, what if we hadn't had that conversation? Would that person have even started filling out applications? That sort of thing. So I think there has been, maybe not as much that I think about explicitly about my advancement, but I'm thinking about the decisions that I can make in this role and the position I'm in to help other people, and that's, what was said earlier too, about just trying to make the space better for people where you can. And like Cheryl said, sometimes we run into each other places because it's just like, we're the only other people there.
Well, I just want to, I agree with everything the panelists have said. And I also think, when we talk about being some of the only ones, I agree with Dr. Hinton's comments about, that outreach is so important. I always try to, think about, as has already been said, I didn't have any Black faculty members who taught me during undergrad or even grad school. So now I feel like it's, part of my duty to, reach back, and I find it very rewarding in my own service to reach back even to as far back as high school to get these students to understand that there are scientists, there are Black scientists around, and we're here and we're willing to help you get to where you want to be. So I agree with everything said.
Thank you all so much for answering that. And also thanks to Javante for asking, for sure. So it looks like we have less than 10 minutes left. Does anybody else have any questions, or is there anything the panelists, anything to add, anything that you'd like to say to our undergraduates who might be thinking about what the next step might be? I guess it sounds like a major theme that people had with their answers is getting involved in a research lab and seeing if that exists at your university. And maybe if a university doesn't have, for example, an engineering program, looking into opportunities to do a summer program at another institution, that might be something valuable. I don't know if any of you had experience with that you'd like to just mention in the last few minutes, unless any of the students have any other questions.
I would say leverage, these types of organizations that you're in, whether it's, like I'm in the Biomedical Engineering Society. I've gone to SFB meetings, not as involved in that group, but, between organizations like the National Society of Black Engineers, Society for Women Engineers, Society for Hispanic Engineers, like a SACNAS, all of these different groups, your chapters at your schools, leverage that networking. You have faculty advisors for those organizations. There's lots of opportunities that can come about. And I think it can be easy sometimes to think like, oh, I don't have enough to, go to that conference, or, oh, I don't know if I'm ready for that. Just go. There's stuff that I'm doing right now as a faculty member that I'm like, I don't know if I'm ready for it, but I just have to push myself to do it, because otherwise it would be really easy for me to say like, oh, I don't have enough to talk about, or, oh, I don't, am I ready yet? If I keep thinking that way, then I'm just never going to do the things I need to do to keep going. So, don't ever think that, you don't have enough experience, have that confidence that, you belong there, and, use those resources around you, people and, online resources and things like that. There's a lot out there. There's a lot of people who are willing to help than you might think. So that's, like we're here as this panel, get our contact information, reach out, with questions and things like that. People are much more willing to help than you might think. Don't think you're bothering people. If they're busy, they'll let you know. So.
I got a question. So is it more of a trade, or is it by, going to school, graduating, all that good stuff?
I missed what you said at the very beginning. Sorry.
Oh, no, I apologize. No, so I said with the engineering, is it more of a knowing a trade, or, going to school, finishing,
Oh, well, I guess within, or you mean like from a training perspective, like, there's so many different things to get involved in. I think, when it comes down to even within like biomedical engineering, people ask me like, what is biomedical engineering? And I'm like, do you have the time? Like, there's so many different things that you can do. And, as far as, if you like, electronics, or if you like, here we're talking about materials, but, you can really define, as you train and get these experiences, you can really define what it is about it that you want to do with it. If you want to, be more hands-on working with it versus working with something that's more computational, like, so working on, coding and programming. And so, I think the beauty of being able to get involved in these different like organizations and asking questions and meeting people is finding out, really what is it, because you learn all this stuff in classes, but then, really figuring out what it is that you want to do with it. And that's where things like labs can be very helpful to see how you can apply some of the certain work. But, it's just, I find it really interesting to see like what people end up doing like once they finish. And a lot of people end up doing, very different things. So, I think it's really thinking about like, what is it that you like about it? Really, and then, find ways to cultivate that.
Right. Thank you too.
You're welcome.
Thanks for your question. Okay. It's still echoing like that. Sorry. Okay, is that all right? Okay. So yeah, it's time to wrap up, but thank you everyone so much for your time and all of your insight, really valuable. And I think it's something that can really help these students decide what kind of career opportunities they want to plan for next. And thank you also to the students for attending. I hope you found this enjoyable. And I'm really glad. Yeah, it was totally inspiring. Thank you guys so much for all of your insight and for your honesty and just describing about your personal journeys and everything. Yeah, just please feel free to stay in touch with the National Student Section because we'd love to get everyone involved and get as many people to that conference in Baltimore next April as possible. So we're just SFB, Society for Biomaterials Students at gmail.com, and we can put you in touch with anybody else that you would like to. But can we do a little Zoom applause hands for our panelists who are just so amazing and really appreciate them being here. Awesome. Well, thank you so much, everyone. Just shoot us an email if you have any other follow-up questions. And thank you all so much again for attending. Hope you have a great evening.
Thank you, everyone.
too.
Thank you for having us.
Thanks.
Thank you.
Thank you.